Okay, so this is an interesting one. This is on the foot of a truck driver, a hard-working truck driver. He says, so basically what it is, it's a bit of a callus here, but if we see as we actually get deeper in here, it's actually a pinch callus. So there's a big crack in there where the skin actually sort of pinches and folds together, and it fills in with callus. So it makes it really, really painful. It doesn't look like much on the surface until we start getting underneath there. And you can see that if you imagine you can see the line of the callus there, that's actually a crevice that goes down into the foot. So we've got to be really careful not to go too deep on this one, because you can cut the either side of the crevice, and but we also have to go deep enough in the middle to remove what feels like a foreign body in his foot. So it'll feel like there's like a line of hard stone or something in there. So we just have to make sure we clean off all the top callus there, and then we'll go around to the side in a second and just start cutting down deeper and deeper into that, and trying not to cut too deeply and cause any pain, because if we go too close to the sides, it'll be painful, or we can actually cause blood occasionally with this one, we've done this one before, and sometimes we get a little bit of blood just to the side where we go a little bit too deep. But he would rather us go too deep and last an extra 2 to 3 weeks than go not deep enough and only have it last sort of 6 to 8 weeks. So we're going in there now, just being really careful not to cut him, go along that side there. It looks like we've probably already gone a little bit too deep there on that top side already. But we'll keep going down. We're always obviously just looking at the patient at this stage, just seeing if it's painful and how much he wants to take off. That's really what determines how much we take off. If they're happy with us to go really deep and remove it all, that's great, we do that. But if not, we take off what they like taken off, just because they'll be able to tell us what's the most comfortable and what sort of outcome they want. So we've gone in there, we just check that with our finger, make sure that we can't feel any more hard skin or callus in there, because that's sometimes the best way to actually feel it. Sometimes you can't quite see it, even when we use the alcohol rub on there to look through the skin. Sometimes you can't quite see it, but you can actually feel it with your thumb, because the gloves we're using are really quite thin. So they're just a protective glove to keep our hands really clean. So keep removing as much of that as we can, always watching the patient, watching to see if there's any blood coming. It looks like we've gone on that really top side. You can't quite see it here. It looks like we've gone a little bit thin there, and you can see just the slightest little touch of blood coming through. So we won't do any more up on that top area, but we've still got some more to get out down in this bottom section. And we just keep removing that, making sure we want to make sure there's no real infection or any tissue breakdown in this one, because that's, with the age of this patient, we don't want any infection. And particularly if he was a diabetic, but that's how we go and remove that, what we call like a pinch callus or a tyloma in that area of the foot. And we'll see him back again in about 10 to 12 weeks.